For those
Hi, Michael.
hi, that have one or more hiatal hernias with their SIBO, whether it's minor or moderate to severe, who are the safest practitioner types to correct those, and what percentage rate success would you say full manual correction is on the first run? And complications that occur with that, with credentials, what should I look for, and what questions might be wise to ask the office before booking an appointment?
An interesting, excellent question. I tell you what, Michael, if you are part of the summit we just did, if you bought that, we have a Q&A coming up with Dr. Steven Sandberg Lewis, and he's actually like an expert on hiatal hernia. And I think it would be really good if you asked him, because he'll have a different answer than me. He knows more than I do. But as far as I know, there's sort of two main ways to go. You can go, I think you're asking about manual, right? So that would be like with a visceral manipulation person. That's the main training I know. I think probably some chiropractors and naturopaths might be trained in it who didn't even take the visceral manipulation specific upledger or Baral courses.
Right.
So then you would have to ask at the office to say, do they have special training in manual adjustments for correcting hiatal hernia? And really, I would say something like, I'm looking for a specialist, someone who's well known for doing this. Like you would just hope they're not going to lie, right?
I
Just to
wonder
get your business. But go
yeah,
ahead.
right. My chiropractor recently passed away. I was so sad. Young guy, who's a neurologist chiropractor. It was amazing. Anyway, he did know how to do some of it, and he had learned it from an old school chiropractor. So it's kind
Yeah.
of like a dying art. And osteopaths, I think, are another resource you could look into, but not all of them.
Yes, absolutely. Yeah. And so in terms of the training, right, because there's people who don't have any, they don't have a thing you can look at because they were just trained.
Right.
But if you were going that route, you would go to either Baral or Upledger, and you'd look at their, find a practitioner, and then you would look behind their names, like you'll see VM for visceral manipulation. The CS is for cranial sacral, and you'll want to see like VM, like 1, 2, 3, 4. You'd look for someone with as many of the trainings as possible. And typically when you see someone with like an extensive list of the VM with all the numbers, oftentimes my eyes will just see, oh, that's a teacher. And then you can just click on them and you'll see, it will say that they're a teacher or a trainer. And that would be your best bet, right? Is the person who trains the other people. So that's one way to find a certified person. But those can be, that manual manipulation can be very successful, but I do not know the rate. I don't know the rate on the first time. I don't know the rate for how long does it hold? Do you need to keep going back? And I would imagine that would differ on the person as well. And the situation of the hiatal hernia. So the other route to go is, of course, surgery. And they've made massive advances in hiatal hernia surgery. That's something I think Dr. Sandberg Lewis could address. They've been making all these advances in the way and the options that they do for the surgery. So